not come in. Hi, my name is Deborah. I'm going to be your nurse today. May I have your name and date of birth, please?
Mr. Valentine, 1965.
Okay, is it okay if I have a seat here?
Yeah, of course. Have a seat.
So the purpose for my visit today is to educate you on a couple of new prescriptions that you have. Is this a good time to teach you about that?
Yep.
Okay. Would you like to go to a different room where it's more quiet and private?
Yes, please. It's
Okay.
too loud in here.
Follow me. All right. Now, I would like to know, do you have any barriers that might impede you from learning how to self-administer medication orally and self-administer it like injecting it?
No.
Okay. Are there any cultural considerations that might impede you or that I should know about?
No.
Okay. Do you know anything about metoprolol or insulin glargine?
No. Well,
No.
they told me about.
Well, about the administration?
Oh, no.
Okay. All right then. So first we're gonna start off by naming your current medications.
Okay.
So you are on aspirin at home, 81 milligrams by mouth daily, and that is for artery blockage. You are on Plavix, 75 milligrams by mouth daily, and that is also for the blockage in your arteries. You were on metformin, 500 milligrams by mouth daily, and that was for your hyperglycemia, which is high blood sugar. I'm sorry. Okay, and you are on lisinopril, which is 25 milligrams by mouth daily, and that is for your high blood pressure. You're also on albuterol rescue inhaler as needed, and that is for your asthma. Okay. Excuse me. All right. So we're gonna talk about metoprolol. Metoprolol is the generic name, and Lopressor is a trade name.
Okay.
And that is a drug used for the prevention of another heart attack.
Okay.
Okay. Now, with this medication, our concern is your risk for falls related to the medication, as evidenced by your heart rate already being at 50 to 80 beats per minute because of the side effects of this medication. So we have a few goals that we would like for you to achieve before leaving the hospital.
Okay.
Okay. So to prevent the fall, we would like for you to try to wear non-skid socks or your sturdy, comfortable shoes if you're going to ambulate the hall.
Okay.
Also, we would like for you to ask for assistance to go to the bathroom, as this drug may cause you to fall. And also, we would like for you to notify us if you're experiencing any dizziness or lightheadedness while you're on this medication.
Okay.
Do you think you can achieve that? All right, so we're going to continue. So metoprolol is a beta blocker, which means it relaxes your blood vessels and it slows your heart rate.
Okay.
And for that reason, that is our concern about you falling. This drug also interacts with your other drug that you're on, the lisinopril, which also lowers your blood pressure. And those drugs together, you have to be very careful not to fall. Like when you rise out of bed, you should rise out of bed slowly and just wait until you get your posture together, and then you stand. Okay. You shouldn't drive any cars or operate any heavy machinery until you know how the drug affects you and you're comfortable with it.
Okay.
Also, you should monitor your blood pressure all the time. You should take your pulse all the time. If your pulse is less than 60 beats per minute, you should not take this medication. Okay. Also, you shouldn't take alcohol with this medication, which it can dangerously interact with this metoprolol. Also, if you're going through any major surgery, you should contact that provider that you are on metoprolol, as it counteracts with anesthetics. Okay. Metoprolol should be placed at room temperature, not in heat or moist places such as the bathroom and the cabinet. Okay. You should take this medication every day at the same time with a meal, and you should never stop it abruptly, as it can elevate your blood pressure, elevate your heart rate, and cause another heart attack. Okay. Also, you should contact us if you feel that your blood pressure isn't going down, because maybe you need to be put on a different medication. Okay. Are you okay so far?
Yes.
If you have any questions, please feel free to ask. You can interrupt me at any moment.
Okay.
Okay? So now we're gonna talk about your insulin.
Oh, okay.
Are you still okay with me teaching you how to self-inject the insulin?
Yes, yes.
And you say you have no prior knowledge to self-injecting insulin at home.
No.
Okay, so we're gonna clean the surface.
Okay.
This is what you're gonna do at home. You're gonna clean the surface. You're gonna take out your insulin vial 30 minutes prior to injecting the medication.
Okay.
You're gonna perform hand hygiene. I'm gonna put on gloves, but at home you should always perform hand hygiene. The reason why you don't want it to be cold is because it can be uncomfortable when you're injecting it.
Okay.
Also, I'm sorry, I forgot to mention, the metropolol can mask hypoglycemia, which means low blood sugar.
Mhm.
So you should closely monitor your blood sugar.
Okay.
And notify the provider if your blood sugars are just too low.
Okay.
Okay? We're gonna use that. We're gonna use this. This is for injection purposes. Skin syringes. Okay. Now we're gonna take the vial. We're gonna rub it between the hands gently and slowly to mix the solution in it.
Mhm.
And place it back on a flat, clean surface. And take an alcohol swab. Rub the rubber top of the vial. Set on the side. Take your syringe, and your syringe is going to be a 1 to 3 milliliter syringe. The needle is going to be 23 to 25 gauge by a half to 5/8 needle. Okay? Inch. All right. So you're going to take the cap off with your non-dominant hand. You're going to withdraw 10 units of air, which is how much insulin you're going to be on. 10 units of insulin subcutaneously daily at noon. Okay?
Mhm.
After you inject that 10 units of air, you're going to inject that air into the air of the vial. Then you're going to turn the vial upside down. You're going to withdraw 10 units, and you have to make sure that the needle is not passing the fluid in the vial. Okay? Go. You're going to firmly tap if you see any bubbles. You're going to use the scoop method to recap the needle. Always use the scoop method to recap the needle.
Okay.
You're going to put that to the side. You are going to then take another alcohol swab, and you're going to rub the area that you're going to inject. Now, the areas that you are able to access are the sides of your thighs, the fatty area, your belly area, 2 inches away from your belly button, and the back of your arms, the fatty part.
Okay.
Okay? It is better absorbed in the belly area. Okay? And you're also going to rotate sides to prevent tissue damage and bruising.
Okay.
Okay? So now you're going to rub the alcohol on your skin. We're going to say this is your skin. Let it air dry. Always let the alcohol air dry. Then you're going to uncap the needle with your non-dominant hand. Then with your dominant hand, you're going to hold the needle as a dart.
Mhm.
Okay? You're going to pinch the skin with your non-dominant hand.
Okay.
Okay? 1 to 3 inch fold. And then you're going to hold your needle at a 45 to a 90-degree angle.
Okay.
Okay? You're going to inject the needle, let go of your skin, and you're going to inject the insulin slowly. Going to wait about 5 to 10 seconds. You're going to pull it out, rub the area, massage the area with the alcohol swab. And then you're going to take your needle and you're going to dispose of it. Okay? At home, you can use an empty laundry container, laundry detergent container, as long as it has the screwable cap back on it.
Okay.
Okay? I would like for you to demonstrate it. Is that okay?
Oh yeah, that's fine.
And do you have any questions
No.
before you begin?
No.
Okay.
So, you said that. Oh, sorry. You said to roll this, right?
Yes.
Put it on the table, alcohol, swab, clean the top of it. Just leave it there, throw it away. Cap it.
Go.
Oh, thank you so much. 10. Inject it with my dominant hand, right?
Non-dominant hand.
Oh.
Well, dominant hand, I'm sorry. Here.
Thank you.
Can you see there?
Yes, I can.
How many units?
10.
Okay.
Flick it. Take all the
Why are you flicking it?
Take out the air bubbles.
Okay.
And you said never to recap, right? Just scoop method.
Yes.
Then another one.
And where are the places where you can inject it?
Oh, you said your stomach, and the side of my thighs.
Okay.
And yeah.
Where else? There's one more place where I asked you.
The back of my arm.
Yeah. It's just you can't reach that, but.
So you said pinch it, and then at a 45 to 90 degree angle, inject it. And then with least alcohol swab to massage it and throw it away. The needle.
I can. For you. And what will you use at home to dispose your needles?
Oh, a laundry detergent container.
Okay. All right then. So it looks like you did a very good job. Are there any other questions or concerns?
No, I'm okay.
All right then. So I'm gonna take you back to your room, and then I'm gonna go back to the nurse's station.
Okay,
If you have any questions, just let me know. Okay.
No, I don't. But thank you so much.
Okay. Follow me.
Okay.